So, Dr. Rishi Manchanda, he is an advocate of something called upstream medicine. Please explain.
Sure. Upstream medicine really is like social medicine. It's called different things. Social medicine, community-oriented primary care. It's been called many things over time. Population-based medicine. The reason I use the term upstream medicine to describe this type of work is because I think there's a power in this parable about three friends. These are three friends who come to a river and they see children in the water drowning in need of rescue. And those children clearly are in need of help, so the three friends jump right in. The first friend jumps right in to rescue those children. They focus in on those who are just downstream, about to drown. They're really kind of doing important work. But the second friend says, you know what, I'm going to build a raft. I'm going to build a raft that can bring more children to safety and prevent those from ending up downstream. And over time they're successful, but not always. And they're dismayed because they still see children coming in need of rescue. So they look up and they realize their third friend isn't around them. And they finally spot her. She's swimming away from them upstream. And they shout to her, where are you going? There are children to save. And their friend continues to swim away upstream, rescuing children as she goes. She shouts back, I know. I'm going to find out who or what is throwing these children in the water.
So it takes a woman.
Exactly. It's usually a woman. Usually a woman who is that upstreamist. So, you know, the reason that I use this parable and talk about upstream medicine is because clearly that's a helpful parable to understand the importance of public health and of other upstream action to improve social services, to invest more in education and transportation and other things that really matter and really drive health outcomes. But it's also important in healthcare to use that parable because we know in healthcare we have that first friend. We have the specialist, that first rescuer who is available to those who are in dire need when they're just about to fall over the water's edge, right? Those who, you have the trauma surgeons, the ICU nurses, the ER doctors. So they're vital and necessary, but they're insufficient. The second friend is something we're seeing a lot more of these days, a lot of attention to the primary care clinician. That's the raft builder. That's the person who coordinates care among other clinicians to make sure you get your annual checkups and make sure you get to your appointments and getting your preventative screenings, etc., your immunizations. It's a vital raft builder that we need more of. We frankly don't have enough primary care clinicians in the system. But just focusing on those two friends is not enough. We also need that third friend in the water in the healthcare system. We need that upstreamist, that person who's working on not just individually trying to find out what's happening, but creating a system that can routinely surface the upstream factors that put people in the water in the first place, that make people sick. What is it about where we live and where we work, where we live and play, that we need as a healthcare system to understand and also to address when there are problems there, so that when patients come in with problems in their health due to mold in their home or a problem at their workplace or a problem with something happening with air pollution close to the freeway where they live, that we as providers know that we can both surface those problems and then connect them to the resources in the community that they need to address them, back to the upstream resources, to the public health, transportation, housing, lawyer resources that can actually help improve health.
Okay, so we can't get it all out now. Tell us how we can read the book. You wrote the book. So once we get that upstream concept down, and we could read the book and then we can begin the work. So tell us how to get that and any website or anything like that.
Sure, so to learn more, anybody who's interested can look online for an ebook called The Upstream Doctors. It was published by people at TED. TED runs a large website where they put talks and books out to help spread ideas across the world.
And you've given a TED Talk?
I've given a TED Talk. It's going to be released in the next couple of months.
Oh, wow.
But the TED book is out. It's called The Upstream Doctors. And it's available as an ebook on various different platforms like Android and Apple. And then people who are interested can also go to healthbegins.org, healthbegins.org, to learn more.
Healthbegins.org. You had to repeat because there's a lot of activity out here, but thank you very much for coming in and sharing that. I hope all the students here at Drew and everywhere else can get this, because this is what we need. This is exactly what we need. When Dr. Freeman first explained it, it just a light went on, and I wish you all the best.
Thank you so much.